Welcome to the Dental Care for Pregnant Women and Infants section of Health Bites. In this video, you'll meet a late-night host with some mighty interesting guests. Let's join the show now.
And now, from New York City, it's the Jimmy Crowne Show. Ladies and gentlemen, Jimmy Crowne!
Good evening, everyone. Hi there. Thank you, thank you. Welcome to the show, everyone. Pete, how are you doing?
Couldn't be better, Jim.
That's great to hear, Pete. Great to hear. Well, we've got a great show for you tonight, and, you know, usually I come out here and I tell some really funny jokes.
Well, you tell jokes.
But tonight we're going to take a more serious approach. Tonight's topic is no laughing matter.
That's right. Tonight we're going to brush up on our facts.
Indeed, Pete. Tonight's show is all about teeth. Did you know that most pregnant women show signs of gum disease?
I did not.
And did you know that almost half of women don't get dental care when they're pregnant?
I did not.
The thing to remember is the mouth is the gateway to the rest of the body. If you don't take care of your mouth, the rest of the body suffers. This is even more important during pregnancy, because if a woman has poor oral health, there's a greater chance that her children will have cavities. Like I said, no laughing matter. So tonight, we're going to talk about how pregnancy affects oral health. We're going to talk about how a woman can take care of her teeth when she's pregnant, and we'll talk about how parents can take care of their infants' teeth and gums.
There's just one problem, Jimmy. You're not pregnant, and you've never been pregnant.
Can't get anything past you, Pete. That's why we have a show full of smart and entertaining guests lined up tonight. Let's meet the first one, shall we? She's a highly respected author in the field of dental care, and her latest book, The Good Mouth, has been on the bestseller list for 4 months. Ladies and gentlemen, a warm round of applause for Ms. Ginger Fields. Ms. Fields, welcome to the show. Please, have a seat.
Thank you for having me, Mr. Crowne.
Oh, please, call me Jimmy. Now, I don't want to make you mad.
Make me mad?
Right, don't want to do that. As I've heard Ginger snaps. So, tell us about the book. How did you come up with the title?
Well, The Good Mouth focuses on how pregnancy can affect a woman's oral health.
And how is that?
For one thing, women tend to snack more when they're pregnant and often end up eating foods that are not good for their teeth, like carbohydrates and high sugary foods. Also, many women get morning sickness.
When my wife was pregnant, she was nauseated every morning for months.
Well, as your wife knows then, vomiting is a reality in many a woman's pregnancy. Not only is it unpleasant, but the acid can harm her teeth.
That sounds rough.
It is. In addition, a woman's hormones go through big changes during pregnancy.
And what effect does that have?
The hormonal changes can cause a woman's gums to overreact to bacteria causing gingivitis.
Gingivitis? What are the signs?
With gingivitis, the gums are swollen and bleed and could be red and tender.
What does it all mean?
What does it mean? It means it's absolutely important for a pregnant woman to practice good oral health. There are risk factors, you know.
I don't know. Please, go on.
For example, gum disease during pregnancy may contribute to babies being born too early or a low birth weight.
Well, this has been fascinating. And I'm sure many women are looking forward to reading your book. It's available in any bookstore?
Of course.
Well, thank you for coming on the show, Ginger. Ladies and gentlemen, a big round of applause for Miss Ginger Fields. Now, Pete, you're going to love our next guest. Virginia Adams is the famous archaeologist who discovered the secret of the Putnam people in Dragoon.
I remember her.
Well, she's back from another trip to Dragoon, where she's uncovered even more about the ancient Putnams. Ladies and gentlemen, please welcome Professor of Archaeology, Virginia Adams. Virginia, welcome back. Have a seat.
Thanks, Jimmy. It's good to be here.
So, what's new with the Putnams?
This trip to Dragoon was amazing, Jimmy, just amazing.
How so? I thought you found all their secrets.
Well, wait until you hear this. Apparently, the Putnam women were very intelligent when it came to caring for their mouths during pregnancy.
Oh, you brought some images with you, didn't you?
I did, yes. They show what the Putnams used to take care of their teeth.
Oh, talk us through them if you don't mind.
This is a toothbrush, carved out of wood, can you believe it? And in the jar is toothpaste. We even analyzed it, and it contains mint and fluoride.
You're kidding.
I kid you not. And look, this is floss, dental floss. We have evidence that all the Putnams, especially pregnant women, brush their teeth twice a day, and floss their teeth at night. This is the best thing a pregnant woman could do for her oral health.
Well, let me ask you this. Did the Putnams have dentists?
As a matter of fact, they did. And the pregnant women made sure to have a complete dental exam during their pregnancies. Nowadays, experts agree that's the best thing to do.
I see.
Also, pregnant women should know if they notice any pain or swelling in their mouths, they should get to the dentist pronto.
Hang on. Danger of infection, right?
Yup. But the pregnant Putnam women did other things that were really good for their dental health.
More rocks? Do you remember all the rocks she brought last time?
Look at this drawing. It's a pregnant woman eating a carrot. On the plate next to her, it looks like celery, an apple, nuts, and popcorn. The very things, along with cheese, meat, and yogurt, that dentists recommend women eat to keep their teeth healthy. And it's also important to note that they didn't eat sugary foods.
Why is all of that important?
Well, Jimmy, carbohydrates like bread or sugary foods can stick to the teeth and cause cavities. Fresh fruits and vegetables don't cause cavities like sugary foods do.
That's good to know.
The more I learn about the Putnams, the more they amaze me.
Well, we appreciate you coming to share this with us. Virginia Adams, everybody. We're going to transition now into the dental care for infants portion of our show. Our next guest is an award-winning actor, best known as the private eye Elvis Freeman in the film noir flick Feeding in Frio. He's reprised the role in the upcoming film Fighting Tooth and Nail. Everyone, Nigel Goldstein. Nigel. Nigel, good to have you.
Thanks for having me, Jim.
Now, your best-known flick, Feeding in Frio, is about feeding infants. And your upcoming film is about dental care for infants. I'm sensing a theme here.
That's right. I'm well-rooted, I suppose you could say. No, the content of the script really swept me up. I did some research of my own, and the risks associated with poor oral health for children are alarming. A healthy start for infants is very, very important.
Really?
Really. Apparently, 40 to 50% of children will have some tooth decay before they turn 5, and more than half of all children will have cavities before they reach the 2nd grade.
Those statistics are staggering.
And if that doesn't make you want to do something about it, man, it is clear you do not have feelings.
Oh, wow. So, what's the biggest health problem infants face, especially as they get older?
Dental caries.
Ah, right, dental caries.
Yes.
What are dental caries?
Dental caries are what you and I call cavities. Now, cavities are the holes that form in teeth when we don't take care of them.
And they're caused by?
Cavities are caused by sugar and germs. Too much sugar in the diet is the main cause, and babies usually get cavity-causing germs from the mother.
Really?
Really. Actually, the germs use the sugar to make an acid, and this acid weakens the teeth. Teeth that are exposed to too much sugar and not enough fluoride will easily decay.
What else will cause tooth decay, especially in infants?
Parents should avoid putting their baby to bed with a bottle. The milk sits on the teeth while the baby sleeps and can lead to tooth decay. Even worse, the baby could choke. So avoid this bad habit. Never put your baby to bed with a bottle, Jim.
We hope you're taking notes at home tonight, folks. So, your upcoming film, Fighting Tooth and Nail, this time has Elvis caught up with vampires?
That's right. It's fitting, being about teeth, that we'd have vampires.
And you brought a clip for us. Set it up for us, if you don't mind.
Okay, in this scene, Elvis is finally confronting the vampire king who is causing tooth decay.
And just to be clear, and for the folks at home, infants are vulnerable to tooth decay?
Oh yes, even a baby's first tooth is susceptible.
All right, let's roll it.
Vampire king.
You want the tooth? You can't handle the tooth.
It's been 10 years since we last met. A decade of decay. Infants are done with the problems you've caused.
What problems?
Tooth decay can hurt. An infant or toddler in pain might not feed correctly. Decay is not treated can cause infections, difficulty in chewing, emergency trips to the dentist, late speech development, even tooth loss.
So, what do I care?
You should. If the baby teeth are lost too early, the permanent teeth may come in all crooked because there isn't enough space for them.
So, what do you think you can do about it?
Very good. Fighting Tooth and Nail hits the theaters in a couple of weeks. Nigel, the film looks great. How can we help you promote it?
A little word of mouth couldn't hurt.
Of course. Nigel Goldstein, everyone. Now we have one more guest on tonight's show. And Pete, I can't believe she's here with us. Here to talk more about dental care for infants, please welcome the Tooth Fairy. Great to have you on our show tonight, Tooth Fairy.
It's so wonderful to be here, Jimmy.
Well, your wings must be tired. I'm sure it was a long flight.
Don't be silly, Jimmy. I travel the world every night. A jaunt to New York City's nothing.
Okay, great. So tonight you're going to tell us about taking care of an infant's teeth and gums?
Yes, those baby teeth are so important, Jimmy.
Huh. It's different than, say, taking care of an older child or an adult?
Absolutely. The first thing they'll want to remember is to clean the baby's gums and mouth often with a damp washcloth.
Even if there are no teeth?
Even if there aren't any teeth, because breast milk and formula can cause a film to form on the gums. This also gets mom and baby used to the cleaning routine.
I see. Well, that's a good point.
Once a tooth does come in, it's important to brush twice daily with a soft infant toothbrush and a very small bit of toothpaste containing fluoride. Fluoride helps our teeth and can be found in our toothpaste and in our water.
The only time we'll really need a toothbrush, huh?
What do you mean?
Well, when there's one tooth, you use a toothbrush. I always wondered why we didn't call them teeth brushes when we got older.
Are all your jokes this bad?
But seriously, baby teeth are going to fall out anyway, so what's the point in taking care of them?
Jimmy, it's very important to take care of baby teeth. Just like the clip Nigel just showed us, if there's any decay, it can cause serious issues later on.
So, should you take an infant to the dentist?
Yes, as a matter of fact, children should go to the dentist by their first birthday. It's the first visit by first birthday rule. Children who do this have fewer dental problems, which is good for their health and can actually save their parents money.
Fascinating. Speaking of money, why do you leave money for a child's baby teeth?
Jimmy, this is to remind parents and children just how important those baby teeth are.
Well, we've got a little time left. And earlier today, we went outside to take some questions for the Tooth Fairy. Are you okay to take a few?
I'd be happy to.
Okay, let's see what's going on outside.
If my infant is teething, what should I do?
Good question. Tooth Fairy?
Many children are soothed by a clean teething ring or a cold, wet washcloth. Many parents also rub the baby's gums with a clean finger to help ease the pain.
Okay, great. Here's another one.
Can breast milk cause dental caries?
Interesting question.
Yes, it's a great question. Breast milk does contain a natural sugar in it, but breastfeeding doesn't actually increase the risk of cavities in baby teeth. You just got to remember to clean the baby's teeth after the last feeding before bedtime.
Excellent. How about one more?
You got it.
How can I find a dentist?
Great question. I wish I'd thought to ask that one.
The best way is to ask your baby's healthcare professional to recommend one, or go to your state health department dental website. It's a great resource.
Well, thanks for the questions, and thank you for flying in to be with us. Well, that's all the time we have. From everybody here at the Jimmy Crowne Show, thanks for watching. We'll see you next time.
I hope you enjoyed the show. Now check out the other videos and games in this section. Don't brush them off. They're important.